site a few times this year. And so I'm Representative John Vander Woude from District 22, bringing you House Bill 617, which is a repeal of the Needle Exchange program that was started about 5 years ago. I don't know if some of you saw the news articles that were out in the paper about the local needle exchange and the raid that happened there. And I asked Health and Welfare for some information on what was going on with the needle exchange. And what I got was one page that says there's 8 operations, there's 1,630 participants statewide, and 594,119 needles handed out, which I did the math. It ends up to be about 365 needles per participant. I believe that this program has not developed the rules that were needed to guide and direct it,
so.
Nor has it had the proper oversight from Health and Welfare. And I think it's time to put this one to rest and start over and come up with a much better plan than what this current statute has put into place. And so with that, Madam Chair, I will stand for any questions. I realize are you done at 3 o'clock? That's what I thought. No.
Well, actually, we're on the floor at 3:30, so we have a little bit more time.
Oh, you have a little more time. Okay.
Yeah.
All right.
But so we plan to be
Out at 3.
Yeah, out of here at 3. Oh, Senator Harris. But we do only have a half an hour, so we are going to work through this testimony. Senator Taylor.
Thank you, Madam Chair. Representative, welcome. Would you be willing to leave this particular piece of legislation in place until the proposed fix that you mentioned is put into place to help protect people who might be relying on clean needles to keep themselves safe from permanent damage and possible death?
Representative Vander Woude.
Thank you, Madam Chair and Senator Taylor. At this point, no. I just feel like there has to be more emphasis and more pressure on in order to get this moved forward. And so I would really like to see this pass and then move forward. I'd be willing to work on it after and try to get something that I think works. I've talked to other
He's not saying anything
good
that was
representative
said
on our side,
in the committee.
and he had said that in another state
From
that he
all the,
worked that it took a doctor's
The
prescription
drug
or a
counsels.
doctor's order before a needle could be exchanged. So I think that the depth and the need is going to take quite a while to develop that, and I'm just uncomfortable with what was seen.
This guy's
and
been in there,
was,
20 years?
What was done here in the Valley, where there was a lot more drug paraphernalia than just needle exchanges going on, and
You'll see it in
so
the
at this point, I'm not, no.
Senator Bjorky.
in the committee.
Madam Chair, thank you.
Testimony.
Representative Vander Woude. You gave a number of 300.
What was that number?
The
Representative Vander Woude.
Thank you, Madam Chair. I should know this by now. Yeah. Thank you, Madam Chair and Senator Berkey. There was 1,630 participants, and the average number of needles they got was 365 per participant.
Follow up.
Yeah, follow up, Madam Chair. I thought that's what you said.
But I did.
I'm from an area that we didn't have needles on the ground until we started a needle exchange program. So my question to you would be, is there a data statistic or whatever that out of that 365 needles, how many are then exchanged for a new needle versus how many that never come back?
Representative Vander Woude.
Thank you, Madam Chair and
Turned off the
Senator
video
Berkey.
for some reason.
I believe that the data that I've seen, but that's not in this report, is that about 10% of those are not exchanged. In other words, there's about 90% claimed to be exchanged, and the 10% is not.
Thank you. See no other questions. We have a number of people signed up to
I figured
testify,
as much.
and then you'll be able to close. Thank you, Representative. Okay, so first I have Amber LaRocco. Please introduce yourself for the record, and you have a couple more seconds than what I put up there. I apologize.
My
Come
name
on,
is
turn
Amber
on the
LaRocco.
video.
I'm from District 15, and thank you, Madam Chairman.
It's right there.
Today I come before you to address the critical issue concerning the continuation and
No,
support of the Safe
still no.
Syringe Program in Idaho, and urge you to vote no to House Bill 617. These programs are not merely a public health initiative. They represent a crucial lifeline for many within our communities, offering sterile syringes, health services, and access to naloxone, an essential and vital tool in reversing opioid overdose. In 2022, we saw 381 overdose deaths, a figure that is on its way to being surpassed by the preliminary data for 2023. The increase coincides with the period during which access to naloxone was restricted and as contracts were renegotiated with distribution oversight. In late October, representatives requested and received comprehensive data on SSPs from the Department of Health and Welfare. The data provided an opportunity for informed decision-making and a redesign of this bill to start taking place to ensure that these essential services continued. Despite having ample time to work on these revisions, there's been no noticeable work and a lack of action. Now facing time constraints, the argument is being made to repeal this bill and postpone any decision until next year, and that strategy is going to have very dire consequences in our community. The termination of or impairment of SSPs, particularly over procedural disagreements, risks not only the state's achievements in public health, but blatantly disregards the lives of those who struggle with addiction. We must understand the real-world implications of policy decisions and acknowledge the responsibility to protect those vulnerable populations. The data and evidence is unequivocal. SSPs save lives by reducing needle sharing and consequently transmission of HIV and hepatitis C. They serve as a vital distribution point for naloxone, directly preventing overdose fatalities. I urge you members of the committee not to let bureaucratic delays of time constraints undermine the health and safety of our communities. We have a moral and civic duty to act with urgency. I urge you to vote no.
Thank you. Any questions? Thank you for your testimony.
Thank you.
Next, we have Norma Yeager.
Madam Chairman, members of the committee, I brought some data for you, some studies to let you know.
Introduce yourself really quickly for the record.
I am from District 21. I've worked in the addiction field and in the drug court field for over 40 years.
And your name, just say your name for us.
Norma Jaeger. Sorry.
Thank you.
Watching the clock. So I have studies that establish the efficacy, that establish the effectiveness of these programs. And we don't have time to talk about these studies. You want these studies?
Yes, you're welcome to give them to the committee.
Why don't you put a picture on there?
Besides that data, and you asked the question about needles being returned, in this current year, the data that was recently identified is for the prior year. This year, nearly 1 million needles were returned and disposed of safely. That's 1 million times that first responder, that a kid on their way to school, that a sanitation or park worker was not stuck by a needle that had been used. But I'm going to tell you that really we can keep this much simpler than that. This decision is about one thing, and that is about saving lives. Repealing this law takes one of the tools, one of the few tools that we have to reach a very difficult population. This population are people who believe that there's no way out of the addiction that they're suffering. Repeal means that some of them will die. They won't get Narcan along with their syringes. They won't get education to avoid infections. They will share needles, and they will continue to use their own needles over and over again, exposing themselves to terrible infections. Because some were mad at a program in Boise, which is now closed, or at the Department of Health and Welfare, programs across the entire state will be shuttered. Because someone decided that these programs are enabling, health promoting and life-saving programs in Idaho will cease. I ask that you keep it simple, that you defeat the repeal of 617. Thank you.
Thank you, Ms. Jaeger. Any questions? Seeing none, thank you. Okay, I'm going to go to we've had 2 against, and I will go to 1 for. Grace Howard. Introduce yourself for the record.
Madam Chair, members of the committee, my name is Grace Howitt and I serve as a policy assistant for Idaho Family Policy Center. We support House Bill 617 and we thank the sponsors for bringing this bill forward. According to statewide public opinion polling that was commissioned by Idaho Family Policy Center in November of last year,
Idaho Family Policy
65%
Center.
of likely Idaho voters oppose taxpayer-funded needle exchange programs. It's not hard to understand why.
Obvious.
Needle exchange programs have devastated communities. For proof, look no further than our northern neighbor Canada or nearby progressive states like California, Oregon, or Washington. The problem with so-called harm reduction approach is that these programs subsidize continued drug use. As Ronald Reagan said, if you want more of something, subsidize it. And with all this in mind, it's understandable that large numbers of Idaho
Libertarian,
voters believe that our state should abandon its commitment to enabling and subsidizing illicit drug use. Please take this opportunity to repeal the Syringe and Needle Exchange Act by voting House Bill 617 to the floor with a do pass recommendation.
Thank you.
Thank you.
Amy McKenzie. Please introduce yourself for the record, and the time is yours.
Madam Chair, members of the committee, my name is Amy McKenzie, and I'm a licensed clinical professional counselor and advanced certified alcohol and drug counselor, and I've worked in substance abuse treatment for the last 5 years. I'm here to ask you to vote no on House Bill 617, which would repeal the safe syringe programs. Safe syringe programs have proven to be a critical tool in addressing the needs of individuals who use drugs and mitigating the impact of bloodborne infections in Idaho. A study conducted by researchers at Boise State University found individuals who access syringe exchange program services were 5 times more likely to undergo testing for HIV and Hep C compared to those who did not utilize these services. This demonstrates the critical role that safe syringe programs play in facilitating access to testing and early detection of infectious diseases among vulnerable populations. Safe syringe programs have been instrumental in preventing overdose deaths in Idaho. According to the Idaho Office of Drug Policy, opiate-related overdose deaths in the state reached a record high in 2019. In 2019, an Idaho citizen died every 31 hours due to drug-related deaths. Communities with access to safe syringe programs have reported lower rates of fatal overdoses compared to those without services. This highlights the life-saving potential of harm reduction initiatives in addressing the opioid crisis and saving the lives of Idahoans. In addition to the quantitative data supporting their effectiveness, safe syringe programs foster trust and rapport between healthcare providers like myself and marginalized communities in Idaho. They provide an entry point for individuals who use drugs to access healthcare services, addiction treatment, and social support networks. By meeting people where they are without judgment or stigma, safe syringe programs empower individuals to take control of their health and well-being. Nearly 30 years of research from the CDC shows that safe syringe programs are safe, effective, and cost-saving to communities. The evidence is clear. Safe syringe programs save lives, reduce the spread of infectious diseases, promote public health in places like Idaho. Advocates for evidence-based policies and practices, it is imperative that we support and expand access to these programs to ensure the health and safety of all individuals and communities.
Thank you. Senator Zeiderfeld.
Thank you, Madam Chair and Ms. McKenzie. Looks like you did a lot of research there. And so I was just wondering if you have any idea how many people who actually maybe overdosed using the needles that we have provided.
Ms. McKenzie.
Madam Chair, Senator
Zeiderfeld.
Thank you. I made an effort. I don't have that data. What I can tell you, though, is those that access safe syringe programs are 7 times more likely to engage in treatment. They will reduce that. Overdose deaths, I believe there was 1,400 approximately that were reversed by Narcan, which is given out as safe syringe programs in the last year.
Thank you. Thank you, Ms. McKenzie.
Thank you.
Okay, Robert Mowry. Did I get that right? Introduce yourself for the record. Time is yours.
My name is Robert Maury.
Maury.
And, I'm from District 18. And so I'm a resident of Idaho my whole life, and I've had the lived experience of being a heroin addict in this valley. I have over or almost 20 years of recovery from that addiction. And I've spent the last 10 years working at LA to Community Action Partnerships, working with the homeless community, finding and housing homeless veterans, and working to stop the spread of HIV and Hepatitis C in our community and engage people in early testing and early treatment. Since the passage of the syringe exchange law in 2019, we have operated a syringe exchange program deeply couched in our HIV and HCV testing and outreach as a part of a broad spectrum of services we try to make people aware of and get them connected to, including medical, mental health, housing, employment, food, shelter, clothing, hygiene, childcare, etc. I've spent nearly all of my adult life in and around addiction in one form or another, and one might say it's like my sole area of expertise. I came here to speak to you about the harm reduction and the Idaho Harm Reduction Project because there's quite a bit of misinformation and innuendo surrounding the Boise Police Department seeking a search warrant of their offices. The author of this bill stated in his testimony at the House Health and Welfare Committee that certain substances were found.
Mr. Moe, let's go ahead and just stick to this bill and this committee, please.
This bill, but okay. But what they were engaging in was injection alternative supplies like foils, straws, glass pipes. And they were engaging in this activity because it is evidence-based and best practices. Outside of the COVID-19 pandemic, which was transmitted through spittle as well as other means, there is a problem of IV and non-IV drug use. Intravenous drug users are only a small fraction of the drug using population. They do face the highest risk for
Mr. Moe, if you could go ahead and wrap up and let us know your position. That's okay. I know you're passionate and we appreciate that.
Can I give my written testimony?
You are welcome to. I think we also got part of that emailed to us, but if you would like to do that. Thank you for your testimony. I'm going to go to Ian Trosor. I think we've got him virtually.
Hi, can you hear me?
We can. Go ahead. Please introduce yourself, and you have 2 minutes.
Okay, thank you very much. Chair, committee, thanks so much for hearing my testimony. My name is Ian Trosor. I'm a nurse practitioner, an epidemiologist in Pocatello, Idaho. I encourage you not to repeal the Syringe Exchange Act. So I did my doctoral project on legalizing syringe exchange in Idaho. I talked to a ton of people about it. I read all the available public research about syringe exchange and kind of what it does to governments and communities where it's legalized. The scientific evidence really supports syringe exchange. The availability, this seems bizarre, that it's very counterintuitive, but the availability of a clean syringe is not usually the limiting ingredient in deciding whether or not to use for someone who's addicted to opioids or other substances. So providing them with clean needles does not increase drug use. It's been demonstrated to not increase syringe litter or increase other crimes. It really, the thing that it does is it decreases the spread of HIV and Hep C. And for HIV and Hep C, of course, they can be devastating diseases to individuals. They're also very costly to the state. On average, the state pays over $40,000 to treat each Hep C infection and over $2 million in lifetime costs for every new HIV case. Syringe exchange has been demonstrated again and again to save government's money, in addition to preventing the spread of these diseases. And kind of to follow up on what Robert was saying, I don't know him personally, but what happened to iHeart, from what I understand, is that they were raided for paraphernalia because they were offering pipes to participants rather than just needles, because they likely mistakenly thought that this was legal. You know, their thinking was if clean needles are safer than dirty needles, then maybe pipes are safer than needles, period. They were not trafficking drugs or other nefarious activities. They were trying to keep people healthy. And that raid ended an organization that distributed Narcan to people who needed it the most. They documented hundreds of overdose reversals just from their organization. They were saving people's lives.
Please wrap
again, I really appreciate you guys taking testimony. And please, I know this seems very counterintuitive, but syringe exchange is helpful. The entire medical community is behind these. Please keep them legal in Idaho. You don't have to publicly fund them. Keep them legal.
Thank you for your testimony. Okay, next we'll have Nicholas Kleinworth. Please introduce yourself for the record, and time is yours.
Madam Chair, members of the committee, my name is Nicholas Kleinworth, and I am representing the Idaho Freedom Foundation in favor of this bill. This bill repeals a program that has lost sight of its intended purpose to help get Idahoans out of the cycle of addiction. Key features of the Idaho Syringe and Needle Exchange Act include connecting users to rehab services and reducing needle stick injuries in our communities. But neither of these key metrics are measured by the organizations running these programs or by the Idaho Department of Health and Welfare. This makes one wonder about the true efficacy of the program, and these data points are crucial to understand whether we are truly reducing harm or contributing to it. In an age where dangerous drugs like fentanyl are so prevalent in our communities, we're playing Russian roulette of the most morbid variety. Overdose reversal products like naloxone are not magic. Sadly, for some, any one of these needles that we've distributed could be the user's last. Studies show that safe injection sites increase risky behavior, not reduce it. In these programs, we're giving people the tools they need to continue their addiction rather than giving them tools they need for help. Repealing this law does not preclude nonprofit organizations from helping people in their communities, nor does it preclude first responders from continuing to distribute naloxone. Rather, it says that as a state, we are no longer going to subsidize these dangerous and illegal activities with our tax dollars, particularly as some organizations running these programs have abused the system. To close, repealing the Syringe and Needle Exchange Act provides an opportunity for Idaho's communities to refocus on treating addiction at its roots. And with that, Madam Chair, I'll stand for any questions.
Any questions? Thank you, Mr. Kleinworth.
Thank you.
Next, we're going to go to Lexi Boyer virtually. Ms. Boyer, can you hear us?
Yes, can you hear me?
Yes. You have 2 minutes. Please introduce yourself for the record.
Perfect. Thank you, Chairman. My name is Lexi Boyer, and I am here today representing myself. I am from Pocatello and still reside here today. I've proudly worked in harm reduction since 2021 as the coordinator of a safer syringe program in Pocatello. I also plan to attend dental school this fall, but also will continue this work in harm reduction throughout my career. I oppose Bill 617 and strongly urge you to not repeal this Syringe and Needle Exchange Act. In my hands-on experience, safer syringe programs not only offer participants access to sterile syringes and provide a place to bring dirty syringes back, but also a bridge to offer hope and resources to people who have felt abandoned throughout their addiction. SSPs can assess the needs and risk of each participant to get to the root of their addiction and help them break down those barriers that contribute to the continuation of their addiction, such as housing insecurity, trauma, and much more. SSPs help with reintroducing people into many different services that I've seen with my own eyes, such as medical, dental, mental health, social services, and then those programs that also help get them into recovery when they are able and ready. Supporters of this repeal say that SSPs hinder people from entering recovery because they will not hit rock bottom by using these programs. But contrary to misconceptions, these programs do not impede recovery, but rather facilitate it. The CDC reports that people who use SSPs are 5 times more likely to enter into recovery. Just like all of my colleagues have said, these programs save lives, and the urgency of this matter is emphasized by the current fentanyl crisis, where the stakes of hitting rock bottom often lead to death. I've witnessed firsthand, even as soon as yesterday, the life-saving impact that Narcan can have within our participants. Many people that I have met through these programs have been revived themselves, but also revived their friends with the help of SSP employees facilitating the distribution and the education on how to administer Narcan. Additionally, just yesterday, I had the privilege of speaking to one of our participants who has come to us for a while now.
Wrap up your testimony.
And he is now sober.
Thank you.
Thank you for your testimony. And again, I urge you to not repeal this act.
Thank you. Any questions? Okay, next on the list, we have Chris Meacham. Please introduce yourself for the record. Time is yours.
Madam Chairman, members of the committee, my name is Chris Meacham. I am a constituent of District 8, and I'm a person in long-term recovery from a substance use disorder. everybody's gone over, and I'm not going to waste your time doing that. I will tell you that for me, recovery happened at the intersection of willingness and opportunity. And I don't believe that there's very much that we can do about a person's willingness to recover. But if we can be there at the moment that they're willing, there's a lot that we can do about opportunity. And these programs extend that. I'm a person who somebody was nice to when I didn't deserve. I'm a person who was treated with dignity when I didn't earn it. And I'm sober today because of that. Thank you. I'll stand for questions.
Questions? Thank you, Mr. Meekum. Thanks for coming. And then I'm going to take one more virtually. Roger Bowe. Mr. Bowe, can you hear us? The time is yours. You have 2 minutes. Please introduce yourself for the record.
I am Dr. Roger Bowe. I'm a semi-retired physician from Pocatello. I have volunteered at the Pocatello Free Clinic since its inception in 1972, and I'm currently serving on the board of directors. From a small beginning, we have enlarged to now serve a large population of persons who have no other resources with free, comprehensive medical, dental, and social services. We reach out to rural areas, to our homeless centers, and to our local crisis center. We work in cooperation with our local police departments and emergency rooms. Several years ago, we made a considered decision to involve ourselves in the Safe Syringe program. To quote our medical director, Dr. George O'Mylan, our clinic staff spends needed time with clients in order to help them receive medical care, counseling, referral to appropriate agencies, and helps them with challenges in their lives that have resulted in drug abuse. We help prevent overdoses by teaching them how to recognize and respond to drug overdose. This important program significantly decreased the number of police calls and hospital visits in our community. We are able to establish relationships of trust and make suggestions that help people begin the road to recovery. I'm concerned that the author of this bill used as support for Bill 1617 or 617 that there is little evidence to support this program. That needle exchanges have reduced the number of needle stick injuries. These statements have been proved false by the direct experience in our clinic, other clinics in Idaho and across the country. A recent white paper by the Idaho Medical Association has provided extensive evidence that show this program works. I personally and professionally believe that this program should not be discontinued. On behalf of Pocatello Free Clinic and other agencies, I urge you to vote no on HB 617. Lives are at stake.
Thank you, Dr. Bowe. Thank you for your testimony. Okay. Committee, we have run out of our time for testimony, but I wanted to just acknowledge that we also have Ariana Thomas, Julianne Donnelly-Zool, who also submitted written testimony for the committee, Paige Ely, and Representative Nate Roberts, who are also here to oppose this piece of legislation. And I apologize that we are not able to get to everyone who testified. Representative Vander Woude, would you like to close?
Thank you, Madam Chair and members of the committee. I would ask that you send House Bill 617 to the floor with a do-pass recommendation. And I find it odd as we go through this process that here's a clean needle so that you can get drugs. And here's in case that drug gives you an overdose, here's an anecdote to it. To me, those conflict of what we're trying to do. I do agree that we have a problem that we need to fix, but I don't see this as a fix. We've stated a lot of different studies. I haven't seen anything locally reported back on how many people were referred and went into recovery through this needle exchange. So Madam Chair and members of the committee, I ask that you send House Bill 617 to the floor with a two-pass recommendation.
Thank you, Representative. Okay, committee, House Bill 617 is before us. Senator Zuiderveld.
Madam Chair, for a motion.
Motion is in order.
Madam Chair, I motion that we move House Bill 617 to the floor with a due pass recommendation.
I have a motion from Senator Zuiderveld and a second from Senator Bjorky. Is there any discussion? Senator Zuiderveld?
Thank you, Madam Chair. I can speak from experience. I have a lot of family members, well, not a lot. Seems like a lot, but I do have family members that have actually had addictions, and you don't give them clean needles. I'm sorry, you don't. And you work with the willingness
so much of
them to want to fix themselves, but you do not enable them by giving them safe needles. We don't give beer steins to those who have alcohol problems. We don't give pipes to those who have other drug problems. We don't do that. And then of course, this is on the taxpayer dollar, and so I just find it interesting that we call it safe syringe, but yet it's how safe is it when they're putting drugs in their body with that syringe that we're providing for them. And so that is why I am motioning for this to go to the floor.
Thank you. Any other discussion?
Madam Chair?
Oh, I didn't see your light. Senator Taylor.
That's okay. My light's a little dim this time of day. Some quick research just for the good representative. 2022, 389 referrals made to community resources through safe syringe programs. 99 HIV infection preventions have happened since 2019. 280 hepatitis C infections have been prevented, that have been documented, prevented from these programs. You mentioned a minute ago that you wondered what it is we're trying to do, and I ask myself that daily here because we continue to hobble our medical profession from doing their jobs with legislation. And this is a piece of legislation that's in place that offers a chance for rehabilitation and hope. And here's an attempt to hobble that one more time. So I'm not going to be supporting this bill.
Senator Bjorky?
Thank you, Madam Chair. Just some thoughts. I remember, probably 30 years ago, after saving somebody that we found with a needle in their arm with Narcan. Back in the day, you had to start an IV and actually inject it into their vein. Or if you intubated them, you can put it down the ET tube. And I remember getting into the ER and telling the ER doctor, friend of mine, we saved another one. And he looked at me and he said, no, you didn't save a life. You just suspended death. We've heard a lot spoken here today about people's feelings from their experience of what this will actually do. I particularly feel that this is not quite the right direction for saving a life. And for that, I will be supporting this bill. Thank you.
Thank you, Senator Bjorky. Okay, so no further discussion. House Bill 617, we have a motion to send it to the floor with a due pass recommendation. All those in favor say aye.
Aye.
All opposed say nay. The ayes have it, and House Bill 617 will be sent to the floor with a due pass recommendation.
I want to point out, I met a lady whose son was in prison in Wyoming, and she shared that he had hepatitis C. And hepatitis C is a permanent will kill you, and it's also contagious. And she also indicated that the Wyoming prison couldn't afford the 90 days of pills, or 90 days, 90 pills, to cure hepatitis C, because each pill cost $1,000. Whereas in India, the cost of those same pills and 90 days of treatment was less than $900. I learned something from that. So anyway, these prisoners who have hepatitis C, which is a liver disease and contagious and terminal, are released into the general population to spread their disease if they come in contact. Nobody knows that they've got hepatitis C. And I just wanted to point this out. These people are doing this for whatever reason. They don't understand anything when it comes to diseases or medical procedures, and they ignored all the drug counselors, and they did the same thing in the committee meeting. It's a shame. No wonder Idaho has got these problems with this kind of legislation. And Vander Woude has been there, 20 years? And he wouldn't be serving that long if the fact that 1995 Citizens Initiative passed term limits for 8 years and repealed it in 2002. Moyle, 26 years. Guthrie, 21. Monk, 16 years. Think about that a while.